a lot of clients and people outside of clients think that finding a therapist is like one size fit all, right?
Mm-hmm.
That because we have credentials, we should be able to do it all.
Going to therapy is not a trend.
Right.
And it's something that you do because you're ready to see change and you ready to do the work. One of the things that I say in my consultation when clients come in to see me or I speak to clients is, are you ready to do the work?
Welcome to the Affirm Wellness Podcast, where we will explore the many facets of wellness. In each session, we'll dive into inspiring stories, give expert tips, and practical advice to help you live a healthier, more fulfilling life. In this episode, we will explore practical ways to make your therapy journey more effective and empowering. From building a strong relationship with your therapist to setting clear goals and staying consistent, we share tips to help you feel more confident, supported, and in control of your mental health journey. Whether you're just getting started in therapy or looking to deepen the process, this episode offers honest insights and actionable steps to help you get the most out of every session. So, Boo Baby, how are you feeling today?
I think I would describe my emotions today as peaceful, just taking it one day at a time. I did a
Mm-hmm.
post the other day about what taking it one day at a time looks like. And so just taking it one day at a time. So at peace and navigating what that looks like every single day, one day at a time.
Yeah,
What about you, Deshaun? How you feeling today?
yeah. One day at a time is another saying that I use on a daily basis. So I appreciate you bringing that up. I'm feeling hopeful today. I'm feeling hopeful that despite everything that's going on, that all will be well.
So I've been a therapist for over 15 years, but I've been in the counseling field or the mental health field for about 20 years. In college, I worked at a place called Kids Peace, and I worked with children that were involved with the legal system and things like that. It was an amazing job. I loved that job because I got to see kids transform.
Mm-hmm.
And it was myself and another woman there, and we would take care about the black girls' hair and stuff like that
Mm-hmm.
because they didn't
I
really
love
have
that.
people to do their hair, so they were looking rough, and we advocated for them, and they got eventually got a stylist there to come do their hair,
Mm.
because for as a black woman, your hair matters, and
Yes.
so
Mm-hmm.
we wanted to make sure that their confidence, were boosted by just helping them with their hair or teaching them about hair care and things like that, and just overall wellness and health. So that to working in most of my jobs have been with the state or county jobs, working with community-based settings, working for accountability courts, and veterans affairs and different things like that. I've had a number of different experiences working in the mental health and counseling field. And of course, owning our own private practice of Firm Wellness, I think has been the highlight of my life. I've
Yes.
always wanted to own a private
Mm-hmm.
practice because I wanted to do things my way. And just have my niche clients, I have the professional clients that I wanted to have. Because I think sometimes people take for granted that professional people or people that look like they're doing well have issues too.
Mm-hmm.
So my niche clients are, professional clients and just people to just have, everyday issues and stressors and things like that. Because I think I put in the work in doing community based work and things like that. So I love that job as well. But I think right now in the season of my life is really working with professionals and people that are considered to worry well.
Yeah. Yeah.
What is your story about your therapy journey?
So I've been in the field for about 20 years, and we have similar beginnings
Mm-hmm.
because I also started with at-risk youth, and I was really young. I was 19 years old when I started in the field, and that was hard work, but it was necessary work.
Definitely.
It was a foundation to, what eventually led to working in the criminal justice system and my work in treatment courts. And I think my work in treatment courts, in addition to private practice, has been my favorite.
Yeah.
I still do a lot of work in treatment courts and absolutely love it. I've learned so much and I've met some amazing colleagues.
Definitely.
I've seen some very amazing transformations from clients.
Mm-hmm.
And I'm just really appreciative of the experiences that I've had, and just really excited about my continual growth in this field. Um, when I think about what I like the most about being a therapist is the transformations,
Mm-hmm.
especially working in the criminal justice field. There are a lot of people that come to treatment and they've been told that they'll never
Mm-hmm.
change. People have given up on them, and not a lot of people have cared about them their entire lives. And so seeing that transformation, seeing that they finally realize that somebody does care, and now hope is instilled again, and they change, and seeing them at graduation, and they thank everybody,
Yes.
the judge and the clinician and everybody. That's just so fulfilling, so
Yes.
satisfying
Yes.
for me.
Yeah.
So that's what I like being, like the most. The work is not
It's
easy,
not an
and you
easy
can't
job
be in this field unless
if
you
you're not passionate
care,
about it. Yeah.
right? Because you're not gonna, hit the lotto in this field, right? So you can't come in thinking that it's a money maker,
Mm-hmm.
right? Not hugely anyway, but you just care about the people, and the most gratifying experience is just seeing those transformations and knowing that I played a small role in
Definitely, definitely.
it. So,
And I think one of the things I love about, or I love several things about being a therapist, but I think, like you said, the transformation, seeing
mhm,
people grow through things and explore things that they were scared to explore,
mhm.
challenge themselves in ways that they never thought about challenging
Yeah.
themselves. And one of the funny stories for me, I have a client that she came in therapy session. She's an older client, probably in her 60s, and she would tell me about her medical appointments and things like that. When she started off with me, she had high blood pressure issues. And
Mhm.
every time she goes to the doctor now, she'll say, my blood pressure is still good. So her blood pressure, she went from having high blood pressure to
Mhm.
not having high blood pressure anymore just because she was coming to therapy and working through some things. She had a lot of trauma, working through some things that she needed to work through and letting go of things that she can't change and control. So we did a lot of work. And so I think that that's what I would say is beautiful, and seeing people do their work, but it also teaching them that just because you're doing your work doesn't mean other people are doing their work,
Mhm.
and so just seeing that growth and it's so beautiful.
Mhm.
So that's what I love about being a therapist and just being there to support people in their transformation
Yeah, it's very, very, very gratifying and challenging, but I wouldn't trade it for the
for the world.
world.
Yeah, definitely,
A
definitely.
lot of clients and people outside of clients think that therapy, finding a therapist is like one size fit all, right?
Mm-hmm.
That because we have credentials, we should be able to do it all.
Yeah.
And so, one of the first things that I say when I'm doing my consultations or meeting clients for the first time, I say, we're not one size fit all. What is it that you need? How can I support you? And we need to make sure that we're on the same page, because I want to make sure that I'm, properly trained, and that I can help you manage whatever concerns that you came to therapy for.
Mm-hmm.
That's important. And so that's one of the biggest tips I think that I would give somebody who is looking to enter the therapeutic process is making sure that you understand what you need first, so that when you're looking for therapists and you're checking profiles and you're doing consultations, that if it's trauma therapy, that you're making sure that they're credentialed and they're trained, that's something they're specialized in, or if it's anger management or depression,
Yeah.
right? Because we just don't do it all. If any
Yes, we don't.
therapist says that they do it all, they're not telling you the truth,
Yeah.
okay?
Yeah.
So that's one of the biggest things, is making sure that you do your research, understanding that we can't do it all,
Yeah.
knowing what you need so that you can properly communicate that to the therapist. What would you say is, like, one of the main tips for finding a therapist?
I first of all want to highlight that going to therapy is not a trend,
Right.
and it's something that you do because you're ready to see change and you're ready
Mm-hmm.
to do the work. one of the things that I say in my consultation when clients come in to see me, or I speak to clients, is, are you ready to do the work? If you're not ready to do the work, then I might not be the right fit for you. Mm-hmm. And so, like Deshonda said, it's not a one size fits all. Mm-hmm. And so, because it's not a one size fits all, it's important to recognize that there are some things that I can give you as a therapist and support you with, and there's some things I cannot. Sure. And so, as a therapist, I'll do your screening, and then I'll see if I can support you. If I can't, I'll refer you out. Because if I try to see you for money or for insurance, whatever purpose, I can do more harm than help you. And so, I want to make sure that you have the right fit as a therapist. So, it's not everybody that you can work with, and everybody, I might not be for everybody might not be for me. Mm-hmm. And so, it's important to be mindful of that. And then also understand why you want to go to therapy. Not because you saw a TikTok about it or an Instagram post about it, but really there's some issues that you want to navigate and work through. Because I think people that have the most challenging time in therapy is people that come in there because there's a trend, because somebody says they wanted to, do it, because I've had somebody do that before, like, oh, I saw it online, I just thought it was something I wanted to try. I mean, you can benefit from it, but the reality is that if you don't want to do the work, or if you're not ready to do the work, then it's not going to work out for you.
And just because you're in a rush, there's some pressing issues that you need to get off your chest, and you've been going through a hard time, doesn't mean that you need to settle.
Yes.
Right? If you have some red flags, not because the therapist is doing anything wrong, it may be a personality thing, yes, right? Yeah. Or it may be timing, right? There's some people who decided not to work with me because I couldn't see them in the evening, or I couldn't see them on a Saturday. Mm-hmm. And that's okay. Yeah. But if you're rushing into it because you need to, hurry up and get in there, you could really be making a mistake.
Definitely.
So just making sure that, you're not settling, that you're patient, you do your research. Another thing I know I stopped doing a long time ago was, making referrals, mm-hmm. right? And so I may say, hey, I heard that this particular therapist is really good in marriage and family, but I really want to direct the client to like a psychology. Definitely. I mean, the person to like a psychology today mm-hmm. or to their insurance panel, exactly. or something like that, so that they can be responsible for doing the research and selecting their own therapist, right? Definitely. Because it's just not, like I said earlier, it's not one size fit all. And I don't want to be responsible for telling someone that they need to go see a specific therapist, mm-hmm. right? Because it's really, it's the person's choice mm-hmm. on who they see. Are there some people who really good in the field? I've made recommendations and it turned out really, really well. Absolutely. But understanding that it's just a recommendation, and you don't have to take that recommendation just because I said that you had to do it.
But I think that's why it's good as therapists. We have a network of therapists that we work with, whether they're male, females, or whatever niche that they have. Mm-hmm. We're able to help clients, do their own research. Like I'm going to refer you to different people, and you can go on Psychology Today and research that person to see if it's a good fit for you. Mm-hmm. I always say that too. Like, it's not a forced referral mm-hmm. or a forced recommendation. It's just, I know I can't support you this way, but this person has these skills that can support you better. Mm-hmm.
And consultations are free.
Yes.
Right? And so, and it takes, you can do a 15-minute consultation, and you can do as many as you need to. Mm-hmm. And, certain questions to ask is, what is your approach? Mm-hmm. What are your credentials? What are your hours of availability? I have these specific issues. Are you able to support me with that? Right? And just kind of, it's a short get to know you session, and I think it's so important. Just like if you were shopping, mm-hmm. right? And you're like perusing shoes, mm-hmm. And you're like, I think this store might have the shoes a little cheaper, and it's the same brand or same quality, right? You want to do the same with therapists. Because again, that process is so important, and it may take a little time. If it's an emergency, of course, right? And you need care, if it's a mental health emergency or a substance use emergency or something like that, you may need more immediate assistance, like going to a hospital or something like that. But if it's not an emergency, take your time. Don't settle. Do your consultations. They're free.
Yes.
And you'll be so happy that you did.
And just like we ask clients questions, you can ask us questions as well.
Absolutely.
And so I do want to highlight something that I think is important, because when I do get referrals and I do consultations, I recognize that some people don't understand that there are therapeutic approaches and that there are
Sure.
different types of clinical providers. And so, for example, there are licensed professional counselors, which Deshauna and I are both licensed professional counselors. There are licensed marriage and family therapists, licensed clinical social workers, licensed mental health master social workers, psychologists, and psychiatrists. Some psychiatrists do therapy, but most psychiatrists do not. And psychologists mostly focus on testing. Some of them do therapy, but most psychiatrists only focus on medication management. They're medical doctors, and so they're not there to do therapy with you. They're there to recognize, for you to highlight your symptoms. So I'm not sleeping well enough. I feel depressed. I'm anxious. I feel like the world is caving in on me, and so they're able to explore your symptoms so that they can give you medication if you need medication, or give you other referrals if needed. Because sometimes when you go to a psychiatrist, they might ask other medical things, because sometimes it might be blood pressure issues or diabetes or other medical things that might be impacting your mental health, and you don't even know about that. And so I think it's important to recognize that each credential play a different role, like a psychiatrist and a psychologist. Most licensed in marriage family therapy focus on marriage and family therapy, and licensed professional counselors can do marriage and family therapy, but that's not necessarily their specialty. And so I've done couples therapy before. It's not my specialty in the sense of I'm not a licensed marriage and family therapist, but I'm good at it. But if you want somebody that might go a little bit deeper into systems and family and things like that, a licensed marriage and family therapist would be best. As well as if you want some testing done related to IQ or your mood or different things like that, psychologists might be great in doing that. We do some minor testing as licensed professional counselors, but our job is not necessarily testing. We use it to help you in our therapy session, but it's not necessarily to read you the scores and things like that, like a psychologist would. And so I think that's important. And then understanding the cultural competence or cultural humility of a therapist. Are they, if you're of a different ethnic group, or if you're a different culture, religion, are they aware of those things? And also, are they willing to learn about it? Because cultural humility is about, not necessarily about a therapist knowing everything about your culture, but it's about learning about it. Because even within a culture, there are different groups and subgroups, and so learning about it from you individually, I think, is an important piece. And so those are things to kind of consider when you're looking for a therapist. And then also their therapeutic approach. I focus more on cognitive behavioral therapy and solution focused therapy, and client-centered acceptance and commitment therapy. Those are some things that I do. And I also do some informed DBT, dialectical behavioral therapy. So a lot of mindfulness involved in it, and a lot of coping strategies to help support clients that I serve. What are some of the approaches that you use, Deshauna?
Sure, same. Over the years, I've gotten a lot of training and implemented my practice, cognitive behavioral, solution focused therapy, client centered therapy. And I also have extensive experience in substance abuse counseling. And so a lot of that is cognitive restructuring.
Yes.
And also teaching refusal skills and things of that nature. I love supporting people who have, your everyday concerns, like work stress, also parenting, very passionate about parenting. Also relationships. I talk to individuals about relationships. I don't do relationship counseling, but I like supporting people and navigating conflicts within the family. And so if there are individuals that have been, when there have been individuals referred to me over the years that have like intense trauma, I do refer out, because trauma counseling requires some extensive training.
Definitely.
And there's some therapists that only do trauma counseling, or only do anger management counseling, or support divorcees. And I know there are also a lot of therapists that also specialize in working with the LGBTQ community.
Yes.
And so those are referrals that I've, sent to other therapists over the years. There are some individuals that say, well, I don't care. I want to see you
Yes.
because personality,
Yes.
right? And so I've seen them for a couple sessions and then referred them out
Yes.
because, maybe I'm just the beginning or I'm, that catalyst for change.
Yeah.
But then if they really want to dive into some of those specialized issues, I'll go ahead and refer out.
Deshaun, you made me think about something when you were talking about a lot of times people go to coaches for
Yeah, yeah,
therapy. A
yeah,
coach is
yeah.
not a therapist. I say that again.
Mm-hmm.
A coach is not a therapist.
Yeah.
Therapists and clinicians can do coaching. We can provide coaching
Mm-hmm.
through certain therapeutic techniques, like dialectical behavioral therapy has a lot of coaching in it, and we do some minor coaching. But a coach cannot do therapy.
Sure.
So I want to highlight that because a lot of times people say I have a coach and they
Mm-hmm.
think that they're getting therapy. If they think they're getting therapy with their coach, and if you're getting therapy with your coach, they're not necessarily doing the right thing.
Mm-hmm. And
And
a coach can tell you what to do,
mm-hmm.
and a therapist is going to make suggestions and recommendations. But a coach is going to kind of a lot of times give you
The
step by
checklist,
step
yes.
on what to do, and we don't tell you what to do. We don't want to be responsible for that. We give you tools and information that you need to make your own decisions.
Yeah, help you find
Right?
your best answer.
Absolutely,
Yes.
absolutely. And getting the most out of it. If I can break it down in the plainest form, I like to use the acronym HOW, HOW. Getting the most out of therapy requires us to be honest with ourselves,
Yep.
honest with the therapist
Mm-hmm.
about what's going on. Because if you're not honest, you can't get the support that you need. And honesty, right, it comes in levels because you're not going to necessarily sit with me as a therapist on day one and tell me everything.
Yes.
Now,
Some people
does
do.
that happen?
It
Absolutely.
does.
Just give it all out,
Spill it
right?
all, yes.
Which is fine with me because I love that. I usually tell those clients, "Thank you."
I know.
At the
For making my
thank
job
you
easy.
so much. Okay, I didn't have to pull it out. But I don't. That's not something I expect because we have to build rapport.
Yeah.
But being honest is so important so that you can really get to the root of what's going on. The open minded, being open minded about what actions that you may have to take to make the changes. And again, don't expect for you to make the changes overnight, but at least being open minded because that's why you came to therapy, right? You came to therapy so that you could talk about the issue, get some help you understand some solutions, and give you some tools that you need to get better. And then the W, the willingness, is the willingness to actually try.
Yeah.
The recommendations that we've made for you, the willingness to do the homework, the willingness to confront some of the hard things, right?
Yeah.
And
Because
so
we know it's not easy.
Absolutely, yeah. So, what are your thoughts about the how?
I mean, I think you said it all. I mean, I don't think there's anything I need to add to that. Is that's the best experience with clients that we have are people that are honest, that are
Sure.
open minded, and are willing. I told you guys earlier that during my consultation, I'm like, "Are you ready to do the work?
Yeah.
If you're not, I'm sorry, I'm not the right therapist
Yeah.
for you. I'm
Yeah.
seasoned in this field.
Yeah.
I don't have time to do too much work
Yeah.
and try to help support you. I need you to do the work.
Sure.
I can't do the work for you." And like Shauna said earlier, we do some coaching, but our job is to help you figure out your best answers. So
Yes.
we're going to help you navigate different situations, explore different things, and give you tools to help you assist you in different ways that you can. So I'm very good on I'm very good at teaching boundaries, anger management, managing depression and anxiety and self-esteem issues and things like that. Those are some of my niche or things that I'm skilled at doing. And so if you're not ready to do the work, those things are hard. Like there's some hard stuff. And so if you're not willing or ready to do the work, if you're not honest about it, then it's not going to help you. So when clients oftentimes tell me like, "Oh, I went to therapy and before it didn't work for me," I'm like, "Did you how?" Were you honest? Were you open minded? And were you willing to do the work? Because we're not magicians. We're not gonna have abracadabra and your life is gonna be better. We don't have that power. Our job is to give you guidance. That's it. To give you guidance and support. That's it.
Sure. As you navigate this space of, thinking about support, think about it as, therapy as an extension of your village.
Yes.
Right. Not that your therapist can be your friend, but it's an extension of that village of support that you need to work through things. And the things that we work through, it doesn't necessarily have to be like something that's emergent.
Yeah.
It can be, career change or navigating a friendship, right? I've supported people over the years, these relationships, right? Should I continue to be with this person? I don't know. I can't tell you what to do, but we could talk about the pros and cons and the implications of continuing this relationship, right? That may be a little bit more a softer issue than somebody with some major trauma and things like that. But whatever you might need support with, it's okay to come and talk to a therapist about it, someone that doesn't know you and can kind of give that neutral ear.
Yes.
That you need,
non-judgmental.
Yeah. And we're not going to agree with everything that you say, like maybe others, like your friends and your family and things like that. When I think about a takeaway from this whole conversation, because I know we could
go on and on. Yes, we can. And we have history.
Yeah, we know the importance. We know how therapy has really changed and helped transform individuals who wanted the help and were willing to receive the help. But thinking about a takeaway, and I alluded to it earlier, it's unique for everybody. This process of therapy is unique for everybody. It's different. And so if you're coming in thinking that it's one size fit all, because you heard somebody who got it in 6 sessions, doesn't mean that you're going to get it in 6 sessions. It may take a year, it may take 2 years or 3 years, however long, but your path is unique and it's not the same for everybody. And the journey looks different. The last thing I want to say is it is a journey.
Yes,
it's not a destination, right? I've had clients that I've been seeing, believe it or not, for 3 or 4 years. Now, I'm not seeing them every week or every month. I may see them every 6 months, right? Just for maintenance sessions and things like that. But it just attests to the fact that it is a journey and it's not a destination. It's a lifelong journey of self-improvement.
Definitely. And thank you for that takeaway, Deshauna. I don't have anything else to add to that. That was pretty good. And so one thing that I want to do today as we end is challenge you. So for today, the challenge would be that if you're already in therapy, take one step to deepen the process that you're in already with the therapist. Set a goal to be more open in sessions. And after each session, journal what you got out of the session, what your takeaway is. And if you're not in therapy yet, take a step towards it by researching a therapist that you would like to work with. Ask for a referral if needed, or write down how you want the therapist to support you. The first step doesn't have to be big. It just has to be your first step.
Thank you for joining us. Remember, wellness is not a destination, but a process, and every step you take matters. Until next time, stay grounded, stay connected, and keep prioritizing your well-being.